So if you're only missing one tooth, why a dental implant over a traditional bridge?
Traditional bridge, we do that all the time. It was one of the original options that are out there. It's been done since 2,000 years. Okay, ancient Mesopotamians have been doing bridges. You know, they tied gold wire and put an ivory tooth in there. I mean, it's old technology. Can it be done? Yes. Is it an option? Absolutely, it's an option. But what I say is, when you get a bridge, okay, you got to shave 2 other teeth down. So I replace one tooth, and I have to drill 2 other teeth. Okay, now. Cleaning bridges, you can't floss the bridge, so you got to go underneath the bridge. So you're jumping over hoops just to keep the bridge clean. And what happens when a bridge gets decay? Now the 2 supporting teeth are going to start to rot. And now you got a 3-tooth problem. Okay, so if you get an option to replace a missing tooth with a bridge or an implant, I strongly suggest looking at the implant, because you replace the missing tooth with one implant and you're done. It's standing on its own feet. You don't have to drill other teeth. Okay, they're in good shape. You don't have to touch them. The tooth replace on its own feet. That's what I tell everybody. You know, you should seriously consider the implant option.
What about cost?
Cost, I'm telling you, Randy, cost-wise, the implant is always cheaper in the long run. It is always cheaper, because guess what? If the bridge does get decay under it, you're going to look at a 3-tooth problem. Now you got to get 2 or 3 implants to replace that. And it's just, you know, listen, everybody who's wearing dentures, everybody who's wearing partials, it started with 1 tooth. Okay, then it went to 3 teeth, and now it's just snowballs into a full mouth of dentures. You know, if you had stopped that problem, you know, nip it in the bud, put 1 implant in there, and just have a bite that's balanced, so the other teeth are not shifting, top tooth's not coming down. It just makes a lot more sense.
And so, the only reason why everybody doesn't do it, because logically, what you're telling me makes sense. So, are they hear the word surgery and they say no thanks?
Yes, yes. A lot of the times they're afraid of the surgery.
But it doesn't really hurt, right?
It does not hurt. I have done implants in my own family. My mom has an implant. Okay, my uncle, I've done multiple implants on them. Okay, it is easier than getting a tooth pulled. People take usually some over-the-counter pain medication for. I mean, of course, they have to take some antibiotics. But you know, as far as pain is concerned, the next day they're back at work. They're back at work, they're functioning fine, they can eat on that side where the implant was placed right away. In some instances, I would say, if you've lost a front, let me tell you this story. Really nice lady, lost a front tooth, just snapped off right at the gum line. She'd had a root canal done years ago, and she had a crown on it, and she bit into lettuce. Can you believe that? Lettuce, and the whole tooth just snapped off at the gum line. She comes in, she's in the people business, okay? She's meeting people, she's in meetings all day, she's talking to new clients. She needs a tooth there. She came in, we took the broken tooth out right away, we placed an implant, and we gave her a tooth on top of the implant the same day. This is game changing in terms of.
So this is the way to go. If you're missing 1 tooth, always get an implant.
Always consider an implant as the first option to go. I mean, there might be times when maybe the implant's not a right solution, but I feel if you with the right training like what we have, with the right amount of data, the diagnostic data that we're collecting, we can always find a way to get you the implant.